Hello again. So thank you for joining today's session. I'm Leia Alkor. I'm representing the IGHO office, which is the International and Global Health Office at the Faculty of Medicine. So today we'll be explaining a little bit about our global health electives and funding opportunities. We'll give an overview of the programs that we are currently offering for this year. I'd like to let you know that this meeting will be recorded. So this is the agenda for today. We're going to do a poll, actually 2 polls, just to get a feel of your areas of interest and how did you learn about this session. And then we'll start with the overview of the offered programs, which are the SANYA's Anti-Racism Indigenous Cultural Safety Training Program, the Advancements in Global Health Studentship, the Global Health Conference Participation Program, and the Global Health Elective Program. We're going to give an overview of the Canadian elective stream and the international elective stream, which is the community health electives in Moshi, Tanzania, and the bursary. And sure, we will keep the end for a Q&A session in case you have any questions or concerns. So I'm happy to see that many of you are interested in the Global Health Elective program. So the majority are interested in the Global Health Elective programs, so that's good to know. Okay, and if you can answer the second question, please. Okay, so most of you knew about this session through emails. Okay, so I'll be saving the best for last. So we're going to address the Global Health Electives part at the end. So just so you get an overview of the different opportunities that we're currently offering. So I'm going to start with the SANYA's Anti-Racism Indigenous Cultural Safety Training Program. This program is offered to all Faculty of Medicine's learners, the ones that are registered in the concentration in global health and social accountability. So the value of this award is $300. It's reimbursed after you complete the training. The application deadline is the same for all of the programs. It's on December 1, 2023, and I believe that you may have received an email from the IGHO office, which has the application link as well. Just to give you a short brief about this program, so the SANYA's Indigenous Cultural Safety Training Program is an indigenous-led, policy-driven and systems-level educational intervention to foster health equity and mitigate the effects of systemic racism experienced by indigenous people in health and other sectors. It's online, it's facilitated, and it's self-paced. So the core training courses can last up to 8 weeks, and it needs around 8 to 10 hours to complete. Participants usually work through the material and actively participate in the interactive activities at their own pace during this 8-week period. So some of the topics that are covered in this program are related to the colonization in Canada, racism, discrimination, and stereotyping, and their impacts on Indigenous peoples in healthcare context, social and structural determinants of health in relation to Indigenous people, gaps in health equity, and a big part is related to taking action, uprooting anti-Indigenous racism, and enhancing Indigenous cultural safety. The second opportunity is the Advancements in Global Health Studentship. This is offered to UGME and graduate programs. The value of the award is $5,000 for a project involving travel within Canada or internationally, and $2,500 for a project based in Ottawa. The application deadline is also on December 1. So for this studentship, it can be based, as I said, in Canada or internationally. Support projects that contribute to at least one of the following areas. So the projects should improve our understanding of our actions to address health challenges in low and middle income country settings, focus on transnational issues, determinants, or solutions like climate change, migration, globalization, advance global health education. It's also important to know that the student is the lead applicant and should identify a faculty supervisor in their application. The project must be equivalent to 6 weeks of full-time work. For projects abroad or outside of Ottawa, at least 4 of the 6 weeks must be spent on site. The project must be completed between June and August, and you need to have ethics approval from a University of Ottawa and or affiliated hospital research ethics board, if applicable. The third program, which we are going to present today, is the Global Health Conference Participation Program. So if you're interested to participate in a Global Health Conference, this program is addressed to you. This is offered to UGME students. It covers up to $500 of their conference-related expenses. It's reimbursement actually of their actual expenses. And this is offered to MD students with a proven interest in global health to attend or present at a conference with a global health focus. And the deadline is December 1 as well. The applicant must be registered as a full-time student of the MD program at the Faculty of Medicine, should have a proven interest in global health, and should demonstrate that participation in this conference will contribute to their global health education and build on their experience. And now I'll move to the Global Health Elective program, the Canadian elective stream. So this is offered also to UGME students. The value of the award is $500, and the application deadline is on December 1, 2023. This program supports MD students completing Canadian electives serving at least one of the following. So either Indigenous communities, refugee communities, or other marginalized population in Canada, including racial or ethnic minorities, newcomer, or socioeconomically disadvantaged populations. The elective should run for at least 4 weeks for first and second year students, and at least 2 weeks for fourth year students. Finally, it's probably the opportunity which most of you are interested in, which is the Global Health Elective Program International Elective Stream and the Community Health Electives in Moshi, Tanzania. So first of all, this program supports MD students in completing international electives in low or middle income countries. But for the 2023-2024 period, the only eligible international elective is the community health elective with the Kilimanjaro Christian Medical University College in Moshi, Tanzania. Just to give you a background of this partnership, so in 2021, the University of Ottawa signed an MOU with the Kilimanjaro Christian Medical University College, KCMUCO. KCMUCO was established in 1997. It offers academic programs in medicine, nursing, basic sciences, and public health through its Institute of Public Health. KCMUCO is affiliated with the Kilimanjaro Christian Medical Center, the KCMC, teaching hospital, which serves as a government referral hospital for northern Tanzania, serving more than 15 million people. Just to give you more details about the elective, the dates are set for June, July 2024. This community health electives in Moshi, Tanzania is available to students of the MD program, mainly UGME. This elective also offers shared accommodations. The orientation is given by the Institute of Public Health at KCMUCO. And it also involves 2 local organizations, Kiwakuki and the Majengo Health Center, providing primary health care and other social and psychosocial support to surrounding communities. As for the eligibility, so student must be full-time student in their first or second year of the MD program, have a demonstrated interest in global health, have a demonstrated understanding of the ethics of international volunteerism and global health work, and be in good academic standing. Successful candidates will be required to ensure the following for their participation to be approved. So you need to request approval through the UGME office, complete mandatory pre-departure training with the IGHO, an online session date is to be determined, and an in-person session is mandatory, and the date is determined on May 10, 2024. You also need to complete the U-Ottawa International SOS Safety and Security online training modules, register on the U-Ottawa International Travel Registry and International SOS, and complete the registration of Canadians abroad on the Global Affairs Canada website. and also attend a debrief session post-elective in September 2024. So applicants are encouraged to apply to the $1,000 Global Health Elective Program bursary. You can do so through the same application. And this gives you an overview about the expected expenses you might have during your stay. So with regards to the flights, the immunizations and prophylactic medicines, the accommodation, food, visa, and local transportation. This is basically the application timeline for this global health elective. So the application deadline is the same for all. It's December 1, 2023. But you can follow this process for this application in particular. So shortlisted candidate will be invited to in-person interviews in the second week of January 2024. Selected candidates will be notified mid-January 2024, and you would need to request approval for an international electives from the UGME office once your acceptance is received. This is very important so you can plan ahead and know the next steps whenever your application is shortlisted. So with that, I'm concluding the information regarding each program, but you can feel free to ask any questions you might have, and you can find also all the information on our funding opportunities webpage at the IGHO office website. So please, if anyone has a question and would like to share it over chat or ask the question directly, please let me know. Okay, so we have a question from Hala. Are there pre-approved communities for the Canadian-based elective, or do we choose and propose the community ourselves? So we had given an overview about the potential communities which you can serve. So you can work with indigenous communities, refugees, or marginalized groups, but you can also propose other communities within your proposal and within your application, and we can advise on that as well. Okay, just a quick note from Dr. Kulkarni. So please note that there will be a global health practicum opportunity in Tanzania for MPH students. This will come out through the MPH program office practicum placement listings in December. There is also a question, how about the funding process eligibility? So you usually apply, if you can mention to which program, but I'm going to give you a general answer. So with regards to the funding process eligibility, when you apply, for example, for the community health elective, you can also mention, it's part of your application, that you want to apply to the bursary too. So make sure to note that in your application as well. Okay. There's another question for the Canadian elective. I'm a bit unsure how students establish a 4-week elective. Is it up to the student to reach out to those communities and set up a 4-week elective term? Yes, in fact, it's for the student to set up that elective. Are they only for Canadian students and professionals? No, actually, we mentioned that the opportunities are addressed to learners of the Faculty of Medicine, and each program has their eligibility criteria listed. Sure, I can put the link for the application forms, of course, on the chat. Just give me a second. Okay, I'm going to share then on the chat the link to the funding opportunities webpage and the link for the application. Okay, there are two applications, one in English and one in French. And I'll share with you the link as well for the funding opportunities. Okay, so this is the link for the funding opportunities. And just checking if someone asked an additional. Okay, I didn't understand the question related to the brochure. Okay, we'll send the PowerPoint to everyone who participated in this session. Okay, there's a question from Shanika. So we apply for the funding prior to having finalized, confirmed international practicum. You actually need to apply through the application, and you need to surely have been established contact for your I'm not sure about which application you mentioned, but I think the application you're mentioning is related to the community health elective in Tanzania. Can you just let
I think that question's about the MPH practicum. So
okay.
that will be that actually goes through the MPH office. So the advertisement for that will be part of the placement book that comes out in December. So you'll have to apply through that same mechanism.
Okay. I think that answers it. And for the application links, these links are for all applications. Depending on the program you registered in, you would get the applications that you can apply to. And you can apply on that application in particular, okay? Okay, yes, this is for the all applications are for University of Ottawa students. So yes. Any other questions or concerns? Okay, So just to answer about a particular question, so for the Tanzania elective, the number of bursary students is dependent on available funding. So usually it's anything between 4 to 6 students. But this is related to funding availability as well for the bursary. Okay. Any other questions? Okay, we still have 5 minutes. If there are no further questions, I'd like to thank you again for joining this session and looking forward to receiving your applications. If you have any questions related to these opportunities, or if you have any issues with your application, feel free to contact us on igomed@uottawa.ca, and we'll be more than happy to answer your questions.